you, Toastmasters of the day, fellow Toastmasters and honored guests. You can eat your way to a healthy heart and a thinner, healthier body. Question: is there a diet that is good for my heart that can help me lose weight as well? As a cardiologist, I get asked this question all the time. Heart disease is the #1 cause of death in the United States today. Also, more than 1/3 of American adults are obese or overweight. I wonder if there's a connection. Of course there is. I first became interested in diets for heart health and weight loss about 15 years ago. A patient, who happened to be about my age at the time, came to me for treatment of his high blood pressure. He was also 40 pounds overweight. He was reluctant to take medication. He asked me if I knew of any diets that could treat his high blood pressure and help him lose weight as well. It was at that time that I came to the realization that I had never had any teaching or training in medical school about using healthy diets to treat common medical problems. They only taught us how to prescribe medications. My patient's question motivated me to learn how to use healthy diets to treat common illnesses. I searched the world literature. After reviewing over 100 diets, I discovered 2 diets that I believed were the best choice for heart health and weight loss. I recommended these diets to my patient. He followed them religiously, and I can report to you today that he had fantastic results. Not only is his blood pressure normal without ever taking any medication, he also is 40 pounds lighter, and he feels better than he's ever felt in his life. I would now like to show you some before and after pictures of my patients. This is before. And this is after. That's right, all this time I've been talking about myself. In this picture from 15 years ago, I was over 200 pounds.
No.
My blood pressure was unacceptably high, and I was having terrible headaches. Now, my blood pressure is normal on no medication. I am the recommended weight for my height, and I feel great. I also think that I look younger now than I did 15 years ago. Wouldn't you agree?
Yes. Yes. Yes.
You too can eat your way to a healthy heart and a thinner, healthier body. The diets that I'm going to tell you about today have been shown to be highly effective in clinical research studies. They are safe and easy to understand. But I won't lie to you, you have to have self-discipline to follow these diets. You will have to be willing to stop eating many of the things that you like, when you like, that are not good for you. In my case, 15 years ago, I had a terrible diet. I'm too embarrassed to tell you some of the things I used to eat. But I had a big incentive to change my eating habits. Although I'm a doctor, and I prescribe medications to my patients every day, the idea of having to take medications myself for the rest of my life was so repulsive to me that I was willing to do anything else to improve my health. So, what are these diets that can make you healthier, thinner, and perhaps younger looking as well. I hate this picture. The two diets that I'd like to tell you about today are the DASH diet and the 8-hour diet. First of all, the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. This diet was designed for people with high blood pressure, but it's an excellent weight loss diet as well. This diet promotes eating foods rich in nutrients that have been shown to lower blood pressure, such as potassium, magnesium, calcium, protein, and fiber. Foods recommended in the DASH diet include fruits, vegetables, whole grain products, fish, poultry, and nuts. Yummy! The diet is low in salt and contains approximately 2,000 calories a day, which is ideal for weight loss. You can find more information about the DASH diet on the internet or in the many books that have been written about the DASH diet. The other diet I'd like to tell you about today is called the 8-hour diet. In this diet, the dieter picks an 8-hour period of the day in which to eat. The remaining 16 hours of the day is a fasting period. For example, you could choose to eat between 8 a.m. and 4 p.m., eating breakfast and a late lunch, or you can choose to eat between 12 noon and 8 p.m., eating lunch and dinner. You can choose any 8 hours you like, as long as the 8 hours are contiguous and uninterrupted. In the 16-hour fasting period, during which you continue to drink fluids, the body has more time to eliminate the toxic waste products that we produce during our normal digestion. These toxic waste products are thought to be partially responsible for many common illnesses such as heart disease, hypertension, inflammation, and cancer. The 16-hour fasting period also allows the body more time to selectively burn fat, leading to weight loss. 8 food groups are recommended in the 8-hour diet. There's a lot of 8s here. 4 groups are called fat busters, and 4 groups are called health boosters. More information about this diet can also be found on the internet and in the 8-hour diet book. You can eat your way to a healthy heart and a thinner, healthier body. I did it, and you can do it too. I always tell my patients that good health is a choice. Which direction will you choose for your life? Will you choose to eat anything you want, when you want, be overweight, and be susceptible to heart disease, hypertension, stroke, and cancer, like this guy? Or will you choose to eat your way to a healthy heart and a thinner, healthier body? The choice is up to you. Thank you, Toastmasters.